name is Nurse Hazel. I'm here to help you today. I'm going to ask you a couple of questions and then the doctor will be on their way to see you, okay? And just to confirm that I'm in the right room, can you please confirm your name for me? Okay, great. And can I have your date of birth? Wonderful. And my friend, what are your pronouns? Perfect. Okay. So I hear that you're having some pain in your head today, is that right? Okay. Are you in any pain now? Okay. And on a scale of 1 to 10, 1 being barely an inconvenience, but a 10 being the worst pain you've had in your life. Okay. Well, I'm glad to hear you're not in too much distress. I'm going to ask you a couple of questions so we can get to the bottom of this, okay? Okay. Now your pain, when you experience your pain, is it on the front of your head, or does it maybe wrap around to the side of your head? Okay. And when you are experiencing pain, how would you rate the quality of your pain? For example, would you say it is sharp, dull, or achy? Okay. Okay. Do you remember what you were doing right before you got this pain? Okay. Nothing out of the ordinary. Okay. Have you noticed anything that makes it worse? Like, are there any aggravating factors? Okay. You feel sensitive to light. Okay. Is there anything else? Okay. And have you noticed any? Okay. And have you noticed sleeping, lying down? Okay. Are you taking any medicine to help with this? Ibuprofen. Okay. And when you take this ibuprofen, how much are you taking? Okay. And is that every couple of hours or just throughout the day? Couple of hours. Okay. Okay, okay. I don't know if you've told me this, but how long has this pain been lasting? A couple of days, about a week? A couple of days. Okay. And would you say this pain, when you experience it, does it feel like maybe someone is gripping your forehead? Or does it maybe feel tingly? Are you feeling any other symptoms that might be abnormal for you? So anything that okay. Okay, great. This will help us conduct a more focused exam. Okay. Now I'm going to ask you a couple of questions, and I understand they might make you feel anxious. Please know I'm not asking these questions to pass judgment. I'm only asking these questions to help give me a better understanding of why you might be experiencing what you're experiencing, okay? My friend, do you drink any alcohol? Okay, okay. And when you drink alcohol, how many drinks would you say you have in a week? Okay. And would you say this is My name is Dr. Fern. I will be seeing you today. Now, Nurse Hazel tells me you're experiencing some pain in your head. Okay, I'm sorry to hear that. I'm gonna do what I can to help you, but first, let me clean and sanitize my hands, okay? Are you having a nice day today? Yeah, other than the pain. I understand. I'm glad you were able to get in. I'm going to do my best to make sure you get the help you need, okay? Okay. So, given what Nurse Hazel told me, I think it would be best to do a cranial nerve exam. Have you ever had one of those before? Okay, no problem. So, a cranial nerve exam is basically me testing the 12 cranial nerves. Those are the nerves that are in your brain. I'm going to be asking you to do very simple things such as smelling, reading. I'm going to test your sensation, things like that. And with my findings, I'm going to try to pinpoint what might be causing your distress, okay? Do I have your permission to continue? Perfect, thank you. Now, my friend, we're going to test the first cranial nerve, which has to do with your sense of smell. I'm going to ask you to close your eyes and place one finger over your nostril, and I'm going to ask if you can, one, smell something, and two, if you're able to smell something, tell me what you're able to smell. We're going to test each nostril individually, so we'll do it twice on one side, and then we'll do it twice on the other side, okay? Now, my friend, please relax, 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 relax. Don't feel like you have to get it right. What is most important is that you do it as genuinely and sincerely as possible. That way, it'll help me get an accurate diagnosis, okay? Okay. Okay. Now, all right, my friend. Please keep your finger over your nose. Perfect. Are you able to smell anything? Okay. And can you tell me what you smell, please? Lavender. Perfect. That's exactly right. Lavender is such a calming scent. I understand you said you were experiencing some mild pain today, so I was hoping the lavender might help you feel relaxed. All right, please keep your eyes closed and keep that same nostril closed. I'm going to see if you can smell anything else, okay? Okay. Are you able to smell anything? Yeah? Okay. Can you please tell me what you smell? Something citrus, right? That's right. We have a beautiful orange scented fragrance, and it smells so good. That'll help give you some energy as well. Okay, now keep your eyes closed. Can you please use your finger to cover the other nostril? Perfect. Are you able to smell anything? Yeah? This might be a little bit of a more niche scent, but it is cropping up a lot more in facial products, hair products. So I'm just curious, but there's no right or wrong if you don't get it, okay? You are able to smell something. Tea tree, that's right. It is tea tree. It has a very unique scent, doesn't it? Are you able to smell anything? My friend, are you able to smell anything? It's a very nice scent, isn't it? That's right. Peppermint. 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 It smells very nice, doesn't it? I love this scent. Well, very good, my friend. Cranial nerve 1 appears to be normal and intact. So now we're going to move on to cranial nerve 2. Cranial nerve 2 is going to help me test your optic nerve, which is your eyes, and it's going to help me with your visual acuity, okay? So what I have here, I have an eye chart, and what I'm going to do, I'm going to ask you to cover one of your eyes, and if you can read the lowest letter that you can, perfect. And if you can read this line for me right here, perfect. Okay. And can you cover your other eye for me, please? Perfect. And can you please read the same line, but can you read it backwards? Perfect. Thank you very much. Okay, so I'm going to ask you to cover one of your eyes. Okay. And I'm going to cover my other eye. And I'm just going to wiggle my fingers into your line of sight. And just let me know when you see my fingers by saying now, okay? Okay. 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 And if you could cover your other eye for me, please, and I'll cover my eye. We're going to do the exact same thing. Okay. 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 Very good. And if you could just keep that same eye closed, I'm going to do one other test, okay? I'm going to hold up numbers 3 times. And if you could just tell me what number I'm holding up, that would be perfect. Okay. Perfect. And now we're going to cover the other eye, okay? And we're going to do the same thing. Perfect, perfect. You did great. Cranial nerve 2 appears to be normal and intact. Okay, so now we're going to assess cranial nerves 3, 4, and 5 with these next series of tests, okay? So first, I'm just going to get my gloves on. Thank you for bearing with me. Looks like my hands are a little sticky, 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 sticky. So now I'm going to ask you to look at the bridge of my nose and look at the wall behind me, okay? Look at the bridge of my nose. Look at the wall behind me. Look at the bridge of my nose and look at the wall behind me. Perfect. So what I was doing was I was testing each eye individually and I was looking for equal constriction and convergence. So now I'm going to test your ocular movement and I'm going to draw out a couple of letters, okay? I'm going to ask you to keep your head still and follow me only with your eyes, okay? Okay, and just remember to do it to the best of your ability. There is no right or wrong, okay? Focus on my finger. Focus on my finger. Okay, very good. And I'm going to do one other letter, okay? Focus on my finger. Focus on my finger. Very good. Thank you. So now I'm going to test your sense of sensation, okay? I'm just going to touch your face with various objects. One will be with my hands, the other will be with a soft cotton ball, and the other will be with a toothpick. And it's not very sharp, but it is a little bit sharp, okay? And I'm going to do so by touching your face, touching your arms, and I'm going to touch your fingers, okay? I want you to tell me, do you feel my touch? Okay. You feel my touch? Okay. Do you feel my touch? Okay. I'm just gonna palpate your lymph nodes. Just gonna palpate your lymph nodes. Just palpating your lymph nodes. And when I touched you, did it feel the same on both sides? Okay, perfect. So next I'm going to touch you with either a cotton ball or with a toothpick. If you can let me know that you feel my touch, and if you can let me know if it feels sharp or soft, okay? Please close your eyes so I can do this. Perfect, thank you. Okay. Keep those eyes closed. Perfect. Feel soft, okay? How does that feel? How does that feel? That feels soft. Did you feel that? Did you feel that? And how did that feel? Sharp. Okay. Soft or sharp? Soft or just on your jawline? Does that feel soft? Feel soft or sharp? Soft, okay. Does that feel soft or sharp? Sharp, okay. And if I may see your hand? Perfect, thank you. Does that feel soft or sharp? Sharp, okay, perfect. Did that feel soft or sharp? Sharp, but soft, excuse me. Perfect. Perfect. May I see your other arm? Thank you. Swipe. Swipe. Did Did that feel soft or sharp? Soft, okay. Very good. Swipe, swipe. And did that feel soft or sharp? Sharp, okay. Thank you very much. Cranial nerves 3, 4, and 5 appear to be normal and intact. Okay, my friend, now I'm going to test your 7th cranial nerve. I'm just going to ask you to make a series of faces. They might seem a little bit silly, but I assure you they are important, okay? Alright, can you raise your eyebrows like this? Perfect. Can you shut your eyes really hard like this? Perfect. And I'm going to take my fingers and I'm going to press one on each eyebrow. I'm going to try to open your eyes, but don't let me open them, okay? Don't be opening your eyes. Don't. Perfect. Perfect. Okay. Now, can you smile really big? Make sure I see your teeth. Perfect. Can you blow a kiss? Perfect. Can you puff up your cheeks nice and wide? Perfect. And I'm going to apply some pressure to those cheeks. Don't let me deflate them, okay? Perfect. Okay. Can you open your mouth? Move your jaw from side to side like this. Perfect. I'm just going to palpate. I'm just going to palpate the muscles of mastication. Perfect. Perfect. Those nerves appear to be time to test your 8th cranial nerve. This will test your sense of sound, okay? So what I'm going to do is I'm going to stand on each side of you and I'm going to whisper a couple of words. If you could just repeat those words for me, that would be great, okay? Okay. Chocolate, coconut, banana. Can you tell me what I said? That's right. I said chocolate, coconut, and banana. Very good. Now I'm just going to go to the other side of you and I'm going to whisper a couple of words, okay? Stipple, relax, click. And what sounds did I say? That's right. I said stipple, relax, click. Cranial nerve 8 appears to be normal and intact. So now, my friend, I'm going to test cranial nerves 9 and 10. This is very simple. First, can you open your mouth for me? Say, ah. Perfect. And now I'm just going to take a tongue depressor and I'm just going to press it on top of your tongue. And I'm going to want you to say ah, okay? And I'm going to want you to say ah, okay? Ah, ah. Perfect, perfect. Cranial nerves 9 and 10 appear to be intact. So let's move on to cranial nerve 11. Cranial nerve 11 is going to have me testing your strength. I'm going to ask you to do a few things, and then I'm going to apply a little bit of pressure, and I'm going to ask you to resist my pressure. I'm just applying a little bit of pressure, so you don't have to resist me too strongly, okay? Okay, thank you. Can you shrug your shoulders for me? Perfect. I'm going to put my hands on your shoulders. I'm going to try to push down. Resist my push. Perfect. And if you could put your arms out in front of me, just like you're defending yourself. Perfect. I'm going to push your arms close to your shoulders. Resist my push, okay? Perfect. Now I'm going to try to pull your arms closer to me. Don't let me pull your arms toward me, okay? Perfect, okay? And if I could see your wrist, I want you to move your wrist back like that. And I'm going to apply some pressure down, okay? Resist, resist. Perfect. Now we're going to do the other way where I'm going to try to push him like that, okay? And I want you to resist, okay? Resist, resist. Perfect. Cranial nerve 11. And now finally we're going to test cranial nerve 12. This is very, very simple. If you could just open your mouth for me. Perfect. I'm going to ask you to perfect. I'm going to ask you to stick out your tongue. And if you can move your tongue from the left and down for me, okay? Left, right, up, down. Perfect. Thank you very much, my friend. That concludes our cranial nerve exam today. I've documented my findings, and although everything appears to be normal and intact, I do understand that you are experiencing some pain today. So, what I would like for us to do, I will have someone from my department call you and schedule some additional testing. Even though I have my findings and I have what I believe is an accurate diagnosis, I understand that there are several possibilities, and I would like to make sure we do testing to rule them out. That way, we make sure my diagnosis is truly accurate. At this time, I believe you are suffering from chronic headaches. So, until we have further testing to prove if this is the case or if we're dealing with something else, I would like you to take your ibuprofen. It appears that the ibuprofen is helping you, so please continue to take it. Take it every 4 to 6 hours, 1 to 2 pills. Do not exceed 6 pills in a 24-hour day, okay? All right. And my friend, do you have any questions for me? No. Okay. Well, thank you. If you do have any questions, please feel free to reach out. You could always call the department or you can email me through your doctor portal. I'm glad you came in today. I want to make sure we catch this early and so that we can get you feeling back to normal soon. Thank you so much, my friend. I'll help see you out. I hope you feel better soon. Feel better soon. Feel better soon.